There is growing concern among scientists and medical experts that a widely accepted and routine medical procedure may be far more dangerous than previously acknowledged. MRI scans, long regarded as a cornerstone of modern diagnostic imaging, are now under scrutiny for their use of gadolinium-based contrast agents, metals that, under certain conditions, may not only remain in the human body for years, but could transform into toxic nanoparticles capable of causing devastating harm. And alarmingly, your everyday diet might be a silent accomplice. New research out of the University of New Mexico has revealed a chilling interaction between gadolinium, a rare earth metal injected into patients to enhance MRI images, and oxalic acid, a naturally occurring compound found in foods like spinach, almonds, chocolate, rhubarb, and even synthesized in the body when vitamin C is consumed. What scientists have discovered is that oxalic acid can pry loose gadolinium from its chemical bonds and help reconfigure it into metallic nanoparticles. Once these nanoparticles form, they don't just float harmlessly through the bloodstream. They lodge in tissues, organs, kidneys, even the brain, and trigger cellular distress signals that ignite chronic inflammation and potentially fatal disease pathways. For most patients, this might seem far-fetched. MRI scans are performed millions of times a year, and only a small fraction report complications. But this assumption of safety is increasingly misleading. What this study makes painfully clear is that the true risk isn't just in the exposure to gadolinium itself. It's in the complex interaction between that exposure and a person's unique biochemical environment. And that environment is heavily influenced by diet, medications, and genetic predispositions. This emerging picture is far more troubling than the simple narrative most people are told, that the metal is safely bound to a chelating agent and swiftly excreted from the body. In fact, mounting evidence has shown that even individuals who have undergone a single MRI with contrast may retain gadolinium in their brains and vital organs for years. Some never experience symptoms. Others, tragically, develop crippling conditions like nephrogenic systemic fibrosis, a rare but fatal disorder where the skin, lungs, and heart become rigid, disabling the patient's body from within. This leads to a terrifying reality. A single contrast-enhanced MRI, combined with the wrong dietary habits or supplements, could potentially set the stage for irreversible damage. And because the reaction may take years to manifest or may go undiagnosed due to the vague and systemic nature of the symptoms, the link to gadolinium exposure is often missed entirely. People suffering from chronic fatigue, joint stiffness, skin hardening, or unexplained neurological symptoms might never be told their condition began with an MRI scan. Even more disturbing is the gap in regulatory safeguards. Although gadolinium-based contrast agents are labeled as safe for most people, this label does not adequately account for biochemical triggers like oxalates or vitamin C. It does not account for chronic low-level accumulation over time, and it certainly does not warn patients about potential long-term consequences for those with impaired kidney function or high dietary oxalate intake. In other words, millions of people undergo this procedure without being informed of the full scope of risk. This is not informed consent. This is medical negligence institutionalized. The healthcare system must reckon with this emerging science, and fast. Physicians should begin to screen patients for kidney issues, dietary risk factors, and supplement use before administering contrast agents. Patients must be warned to avoid high oxalate foods and supplements like vitamin C in the days before and after an MRI scan. But even these measures are just a stopgap until we can replace gadolinium entirely or create contrast agents that are truly inert and biologically safe. In the meantime, the team at the University of New Mexico is working to gather more data through an international registry of patients exposed to gadolinium. They are collecting blood, urine, and even fingernail samples to understand who is most at risk and why. But that research, while vital, is only the beginning. We are at the edge of a medical reckoning. The widespread use of gadolinium-based contrast agents has been normalized without enough transparency, long-term study, or patient education. What was once seen as a routine diagnostic tool is now increasingly viewed as a potential contributor to chronic illness and even early death for some individuals. The most tragic part is that this has been hiding in plain sight, cloaked by decades of complacency and the assumption that what is statistically safe for most is safe for all. Until we demand better screening protocols, more rigorous testing, and full disclosure of risks before imaging procedures, more people will unknowingly walk into MRI suites, trusting that their scan will provide clarity, only to emerge with invisible, irreversible harm that may take years to detect. The burden should not fall on patients to piece together a puzzle of symptoms and dietary triggers. The burden should fall on the medical establishment to act, not after decades of damage, but now, while there's still time to prevent the next silent injury.